So let's talk about another interesting thing when it comes to healthcare, especially hospitals now. The consent they take for treatment. Is that same as privacy consent? No, it is not. How is it different? Let's talk about it. Welcome to my YouTube channel where you daily see new content on data privacy. And as I said, let's talk about the difference between the consent taken for the treatment and the consent that should be taken to show how the personal data is going to be processed. Now, what are those two consents to begin with? A consent that is taken from the relative of the patient, if patient himself is not in a position to give you the consent. It's a regular consent on treatment. You reach the hospital, you provide your consent. Yes, I want to get him treated, and I trust that the doctor is doing his best. Right? It's a good practice. It's a very, very mandatory practice from the healthcare ethics. And then what you now have is privacy consent. Privacy consent that should be treated different as treatment consent, because treatment consent is typically on the lines of the medical ethics. Privacy consent is purely on the lines of how are you keeping the data private? How are you taking care of the fact that the personal data of the patient is not tampered with, is not breached? Right. So, what is a privacy consent? A privacy consent is the consent that is taken from the patient or his attendant, his family, his relative, in terms of how the personal data and what personal data would be collected, how would it be stored, how would it be processed, what is the purpose of collecting this personal data, what is the usage of this, would it be shared with third parties? If yes, then what kind of third parties and what is the mode of sharing it, and then when and how would that get deleted as well. The purpose is to inform how the data will be used and processed. There also allows the patient to take control over his own data. Right? There could be a parameter that the hospital staff asked for, and you think you don't want to share that. You can share your concern and either get convinced and share the information or don't share the information. It's a legal requirement with respect to the privacy regulations, and this includes handling data across all medical systems, right? Whether it's a healthcare or a lab or a research center or anything. And what is the treatment consent? Treatment consent is the traditional consent that a hospital takes. Patient reaches there, and the hospital takes a consent after explaining the line of. This could be a surgery, this could be a medication, this could be a medical intervention, the smaller one, larger one, depending on whatever it is. Yes, when I say larger one, if it is an emergency case, you might end up signing it without a review, but otherwise they explain you the treatment and they allow you to decide whether you want to get the treatment done or not. That helps you understand the procedures, the risks, and the alternatives. If this procedure is not done, then what else can be done? What are the risks of not doing this procedure? That also authorizes the healthcare provider of the kind of treatment he is giving to his patients. For example, a patient reaches a hospital complaining about his knee pain. So the hospital staff will ask for basic contact details. And assuming that he is with his family or a guardian, so they provide the basic contact details. This includes what are the ailments he is having, other than the knee pain, also what medications he takes, what is the payment mechanism he'll adopt. This is something which is very important that every hospital asks you. Is it through the insurance or are you going to pay it yourself? This all information should include a consent form and a sort of a privacy notice that we are collecting this information and this is the purpose of collecting it. This is the way it will be used. Would you allow us to use your information for these things? For example, they say that we'll do marketing with you. You don't want to allow marketing, you cross it, right? Or don't check it. This is a privacy consent. I want these things to be allowed with my personal data and these not allowed. However, when the doctor tests and examines all the records and reports and says, well, I need to perform your knee surgery. Now, he needed your existing ailments, medications, all for these things. He tells you the cost, he explains you the alternatives, the positives, the risks, everything with related to your knee surgery, and says that, okay, if you agree and if you are convinced that you want to get this done, please sign the consent form. And this consent form is a treatment consent. Mostly they don't write the exact treatment on the treatment consent form, not even the risks that are there on with respect to that particular line of action. But then that's beyond privacy. So let the ethics mechanism of the hospital and their healthcare regulations think about it. For us, from privacy point of view, Privacy is about how they'll use my personal data, and treatment consent is about how they actually do my knee surgery. And do they need a knee surgery? Or they may say that, okay, you keep taking these medicines for another 6 months, or take this physiotherapy for 6 months, and if you still have knee pain, then we'll plan about the surgery. So these are the two different consents. If patient agrees, he sends the treatment consent. Therefore, he is having two consents when he reaches the hospital. Key differences. Privacy consent focuses on collection and processing of data. Treatment consent talks about the medical procedures. Privacy consent says my purpose is to inform you and seek your permission on utilization of your data, and the treatment consent says treatment, utilization, and performance of treatment is what is my purpose. The legal basis of privacy consent, DPDP Act 2023 with respect to India, GDPR, CCPA, worldwide, other regulations. Medical ethics or guidelines with respect to treatment consent. Privacy consent is taken when required. Every time they need your personal data, they can take a consent afresh for that particular part of it. Medical consent or treatment consent is taken whenever a procedure is to be performed. Privacy consent controls patient can withdraw the consent. Medical treatment, once a procedure starts, you cannot withdraw. Doctor cannot open up your knee and then wait for your consent or your re-decision. And of course, there's a medical issue. Privacy consent covers data flowing from doctors to labs to insurance to partners, and treatment consent covers the procedures, the medications, the surgery being done on the patient. So why does this matter? Why is it important to have two different consents? With respect to legal compliance, DPDP Act says you treat them separately. For trust and transparency, the patient deserves to know how his personal data is being handled. For your audit and record keeping, you should keep them separate. You should know that the patient agrees or disagrees for you to call him up later on for marketing, but he is currently ready for his knee surgery. Right? Avoid any legal liability, because if you use it for marketing and patient comes back to you, then you can't say that because I have treated him, therefore I have the right to do marketing with him. Until, of course, that's on privacy notice and a consent is taken on that, which is the privacy consent, not the treatment consent. Right? As best practice, treat both of them separately. Privacy consent is taken before diagnosing. Right? It is not after diagnosing or after telling the treatment. And privacy consent should not impact treatment. If a patient comes in and says, well, I want knee surgery, but I don't want you to call me up again and again for marketing or telling me about your medicines. I'll get the surgery done, I'll follow your prescriptions, I'll come back to you if I need more help, but not by means of marketing, right? So privacy consent should not impact the treatment. Purpose in both cases should be clearly explained. You should allow easy, non-impacting withdrawal of privacy consent. Right? Patient can easily withdraw the privacy consent, and you should train your staff with the difference between the privacy consent and the treatment consent. So that's about the best practices when it comes to privacy and treatment consent. Keeping them separate also allows you to avoid any legal liability, any confusion running from pillar to post in the courts to get your things sorted right. Mixing of them can create legal issues, and it's a big hassle for sure. So that's about best practices and differences between the privacy consent and treatment consent. I hope you like the content of my video. Please press the bell and like icon. Subscribe to my YouTube channel and share your feedback in the comment section. Thank you.